Welcome to Health Practitioner. Hello to all my health-conscious friends. I'm your health partner. Today we're diving deep into an extremely important yet often overlooked health topic: how to care for your blood vessels. The key lies in the vascular endothelium. Many friends often ask me, "Doctor, my blood pressure isn't very high and my cholesterol is normal, so do I still need to take special care of my cardiovascular system?" The answer to this question might surprise you. Actually, most people overlook the most silent yet most health-impacting important player in our bodies: endothelial cells. These cells are like the skin of blood vessels, invisible and untouchable, yet they determine how blood flows, whether inflammation erupts, and even whether cancer cells can take advantage of vulnerabilities. When this layer of vascular endothelium is healthy, blood flows smoothly with minimal inflammatory responses, and the body functions like a highway without traffic jams. But if it begins to suffer damage, problems arise like small stones falling into an engine, gradually wearing down the entire machine, ultimately leading to serious cardiovascular diseases. First, let's understand what endothelial cells are. The vascular endothelium is a single layer of cells covering the inner walls of blood vessels. They're not just passive barriers, but extremely active physiological regulators. According to the latest research from 2024 to 2025, we've discovered that endothelial cells are responsible for 6 key functions. First is vascular tone regulation, controlling vasoconstriction and vasodilation. Second is vascular permeability control, determining what substances can enter and exit blood vessels. Third is antithrombosis formation, preventing unnecessary blood coagulation. Fourth is inflammatory response regulation, controlling the degree and timing of inflammation. Fifth is angiogenesis, forming new blood vessels when needed. Sixth is maintaining oxidative reductive balance, fighting against free radical damage. Most excitingly, the latest single-cell genomics technology has revealed the unique characteristics that endothelial cells display in different vascular locations. This means that in the future, we may be able to provide individualized care and treatment for the vascular endothelium in different parts of the body. Now let's discuss the core molecule of vascular endothelial health: nitric oxide, abbreviated as NO. I like to call NO the blood vessel's natural massage therapist. When endothelial cells are healthy, they produce sufficient NO. This magical molecule can naturally relax blood vessels, prevent abnormal platelet aggregation, reduce inflammatory responses, and even has anti-aging effects. Research from 2024 to 2025 has reconfirmed NO's key position in vascular health. NO is produced by endothelial nitric oxide synthase (ENOS) in endothelial cells. It activates soluble guanylate cyclase in vascular smooth muscle cells, increasing cyclic guanosine monophosphate levels and causing vasodilation. This process is like giving blood vessels a professional massage. However, when the body lacks a substance called tetrahydrobiopterin, BH4, problems arise. ENOS becomes dysfunctional, no longer producing beneficial NO, but instead producing harmful superoxide, leading to increased vascular oxidative stress and endothelial dysfunction. It's like the massage therapist suddenly becoming a destroyer. Notably, 2024 research found that oral BH4 at 400 mg twice daily for 4 weeks can normalize vascular dilation function and improve vascular oxidative stress. This provides new directions for understanding and treating endothelial dysfunction. Next, we need to discuss the dangers of endothelial dysfunction. This is a health warning signal that requires special attention because it has no obvious symptoms, yet it's an early warning signal for cardiovascular disease, appearing earlier than traditional cholesterol or blood pressure abnormalities. 2025 research has discovered a concerning phenomenon: endothelial cell dedifferentiation and increased heterogeneity are important features of atherosclerosis progression. More seriously, endothelial cells undergo endothelial to mesenchymal transition, playing a key role in disease development. Most dangerously, endothelial dysfunction is unfeeling. It won't cause immediate pain or sudden collapse, but it will make blood vessels lose their protective power, allowing white blood cells to run wild, platelets to aggregate abnormally, and inflammatory factors to surge into vessel walls. This is exactly the outpost of hypertension, arteriosclerosis, stroke, and myocardial infarction. Many people appear to have normal indicators, but their vascular endothelium has already begun to collapse. We just haven't noticed it. It's like not noticing a leaky roof until the floor gets wet and walls develop mold, only then realizing something went wrong long ago. So, how do we scientifically care for our vascular endothelium? Let's start with the most effective method: exercise. We all think exercise is for weight loss or fat burning, but actually, exercise's real power lies in awakening the vascular endothelium's repair capacity. A 2024 important study called VascuFit found that regular exercise is the most effective method for improving endothelial function. Every time you engage in brisk walking, squats, or stair climbing, increased blood flow stimulates endothelial cells to release nitric oxide. This is like giving blood vessels a professional massage, not only widening vessels, but also preventing platelet adhesion, preventing thrombosis formation, and even reducing inflammation and providing anti-aging benefits. Research shows that nonlinear periodized aerobic exercise can significantly improve brachial artery flow-mediated dilation, FMD, by 2.38%, and this effect is not influenced by traditional cardiovascular risk factors. This means that regardless of your cholesterol or blood pressure levels, exercise can directly improve your vascular endothelium function. A 2024 network meta-analysis further confirmed that aerobic exercise is the best choice for improving vascular endothelium function in middle-aged and elderly people. Various exercise forms, including aerobic exercise, resistance training, and combined training, can all significantly improve endothelial function. Exercise works through multiple mechanisms, including increasing NO production and improving glycocalyx function. Every time you move, you're actually helping maintain your blood vessels' skin. Like applying moisturizing serum, daily application shows visible results. We recommend that the general public engage in 2.5 to 5 hours of moderate intensity exercise weekly, or 1 to 2.5 hours of high intensity exercise weekly. Next, let's discuss nutritional strategies. Endothelial cells are sensitive. They remember what you eat. Research from 2024 to 2025 clearly indicates which foods are most beneficial to the vascular endothelium and tells us which foods cause vascular damage. First are polyphenol-rich foods. Blueberries, grapes, dark chocolate, and other polyphenol-rich foods have powerful antioxidant and anti-inflammatory properties. Different polyphenol subclasses, including flavonoids, phenolic acids, and phenolic amines, can provide protective effects targeting multiple molecular pathways. Particularly noteworthy are cocoa polyphenols, which can inhibit arginase, support blood flow, and protect NO synthesis. Meanwhile, polyphenols can help stabilize tetrahydrobiopterin, BH4, maintain normal ENO-S function, and ensure endothelial cells can continuously produce beneficial nitric oxide. Dark green vegetables are also favorites of the vascular endothelium. Spinach, arugula, and other nitrate-rich vegetables can directly promote NO production, providing the necessary raw materials for the vascular endothelium. This is like providing high-quality building materials to endothelial cells, allowing them to better maintain vascular health. Omega-3 fatty acids are equally important. The latest systematic reviews and meta-analyses found that omega-3 fatty acids from deep-sea fish, nuts, and olive oil can activate ENO-S in endothelial cells. Both EPA and DHA can exert this effect while also reducing triglycerides, resting heart rate, and blood pressure, improving vascular compliance and vasodilatory responses. Soy products and whole grains shouldn't be ignored either. They can stabilize blood sugar while caring for blood vessels, providing a stable nutritional environment for the vascular endothelium. Conversely, some foods are harmful to the vascular endothelium. High sugar, high fat, processed red meat, fried foods, and sugary drinks cause endothelial inflammation, reduce NO, slow blood flow, and raise blood pressure. They might seem fine on the surface, but they slowly erode vascular elasticity, seriously affecting vascular endothelium health over time. When endothelial cells frequently encounter these harmful substances, they become irritable, stop working properly, and instead begin producing inflammatory substances, destroying the blood vessel's protective mechanisms. Now we need to discuss an often overlooked but extremely important factor: the impact of stress and sleep on the vascular endothelium. 2024 research particularly emphasized this issue. Have you ever felt this way? When stressed, your shoulders tense up, your head feels swollen, your heart races, and you toss and turn at night, unable to sleep well. Actually, that's not just an emotional problem. Your vascular endothelium is also staying up late and experiencing nervous tension. Chronic stress causes excessive sympathetic nervous system activity, elevated cortisol, suppressed nitric oxide (NO), and endothelial cells become dry and fragile, leading to increased blood pressure and inflammation, all of which quietly increase cardiovascular risk. Research found that irregular sleep is directly related to large artery dysfunction, and acute psychological stress directly affects endothelial function. Sleep deprivation increases oxidative stress, leading to vascular inflammation and endothelial dysfunction. Inflammatory markers like CRP and IL-6 are significantly elevated in sleep-deprived and high-stress individuals. Conversely, adequate 7 to 9 hours of quality sleep is the golden period for endothelial cells repair. During sleep, endothelial cells enter a self-cultivation mode, maintaining vascular health and preventing atherosclerosis through promoting repair and reducing inflammation. So, sleeping well is truly not just for emotional stability. It's the most critical period for daily vascular repair. We must give the vascular endothelium adequate rest and repair time. Next, let's discuss the scientific evidence for nutritional supplements. Many friends ask, should I take nutritional products to protect my blood vessels? First, let me clarify that nutritional supplementation can help with repair, but it shouldn't be an excuse for poor eating habits and staying up late. The body's ability to self-repair is paramount. Supplements provide additional support for those already maintaining healthy habits. They're not miracles. Regarding nitric oxide promoters, 2024 clinical trials showed that NO-Supp lemons can significantly reduce systolic pressure by 4 mmHg and diastolic pressure by 5 mmHg. L-citrulline has better absorption and durability compared to L-arginine. The recommended L-arginine dosage is 1.5 to 2 grams daily for 4 to 7 weeks to improve aerobic performance. Curcumin also has good research evidence. Studies confirm that 2,000 milligrams of curcumin daily for 12 weeks can improve endothelial function, with forearm blood flow response to acetylcholine increasing by 37%. It works primarily by increasing NO bioavailability and reducing vascular oxidative stress. Regarding tetrahydrobiopterin BH4, the previously mentioned research found that oral BH4 at 400 milligrams twice daily for 4 weeks can normalize vascular dilation function and improve vascular oxidative stress. Resveratrol, nitrates, coenzyme Q10, vitamins C and E. These nutrients indeed show benefits for the endothelium in research, but the best effects are always seen in people who already have good habits and just need a little enhancement. Regarding safety, L-arginine and L-citrulline are generally safe at recommended doses, but may cause mild gastrointestinal discomfort. It's recommended to consult professional medical personnel before using any nutritional supplements. Now let's discuss testing for vascular endothelium function. Many people want to know whether their vascular endothelium function is good or not. Currently, the most commonly used non-invasive method for assessing vascular endothelium function is flow-mediated dilation, FMD testing. This test has achieved standardization, has excellent reproducibility, and negatively correlates with future cardiovascular events, making it an important predictive indicator. 2024 research based on 1,079 healthy individuals aged 18 to 76 established standardized reference values. The study found that FMD values negatively correlate with age, BMI, and BEL, pressure. For every 10-year increase in age, FMD decreases by 0.4. Besides FMD, peripheral arterial tonometry as a user-friendly new technology is developing and has the potential to significantly impact cardiovascular research and prevention. Based on the latest research from 2024 to 2025, we now have evidence-based vascular endothelium care strategies. The latest cardiovascular prevention guidelines particularly emphasize the importance of lifestyle interventions. Regarding diet, Mediterranean or DASH dietary patterns are recommended. Increase intake of plant sterols or stanols, N3 fatty acids, and viscous fiber, while reducing sodium intake and increasing potassium intake. This dietary pattern has been proven effective in protecting vascular endothelium function. Regarding exercise, patients with diagnosed cardiovascular disease should engage in moderate to high-intensity aerobic exercise more than 3 times weekly for 30 minutes each session. The general public should aim for 2.5 to 5 hours of moderate-intensity exercise weekly, or 1 to 2.5 hours of high-intensity exercise weekly. Weight management is also important. Research shows that weight loss is associated with improved dyslipidemia, reduced blood pressure, improved insulin sensitivity, and improved endothelial function. Smoking cessation effects are immediate. Short-term effects of smoking cessation include decreased heart rate and blood pressure, while long-term effects significantly improve endothelial function, allowing endothelial cells to regain a healthy working environment. Most importantly, we must recognize that cardiovascular care isn't just about taking medication. It's about letting the body repair itself. Our bodies have amazing self-repair capabilities. The key is providing the right environment and conditions. Care for your vascular endothelium by being kinder to these tiny yet important cells starting now. Walk an extra block, drink 1 less sugary beverage, sleep half an hour earlier, eat an extra bite of dark green vegetables, learn to slow your breathing rhythm. These small actions might seem insignificant, but they will gradually restore elasticity to endothelial cells and return the body's internal rhythm to balance. When we treat the vascular endothelium correctly, it will reward us with longer, healthy lifespans. Blood vessels are silent organs. When they start crying, it's often when we become ill. Rather than waiting until heart problems, soaring blood pressure, or brain hypoxia to think about cardiovascular care, let's start today using evidence-based methods to protect our vascular endothelium. Research from 2024 to 2025 has opened new possibilities for vascular endothelium care. Future research directions include developing individualized endothelial care strategies, applying new endothelial function testing technologies, optimizing precision nutritional interventions, and conducting in-depth research on endothelial resilience mechanisms. These discoveries not only provide solid scientific foundations for cardiovascular disease prevention, but also emphasize the importance of early intervention and comprehensive health management. We're in a new era of vascular health awareness, with more scientific tools and methods to protect our most important life conduits. Remember, vascular endothelium health is in your own hands. Through regular exercise, balanced nutrition, stress management, and adequate sleep, you can effectively maintain endothelial function, prevent cardiovascular disease, and enjoy a healthier, longer life. Let's use scientific methods together to give our vascular endothelium the best care, invest in our health, and work hard for our family's happiness. Healthy vascular endothelium is the foundation of healthy longevity. Well, today's sharing about vascular endothelium care ends here. If you found this content helpful, please subscribe to our channel and feel free to share your health insights and questions in the comments. Remember, health is a lifelong endeavor. Let's work together using scientific methods to protect our cardiovascular health. See you in our next episode.